Welcome to the VCA Voice Podcast. I'm your host, Dr. Marie Kerl. Join us as we dive into inspirational stories about our caring and capable associates and their commitment to guiding healing journeys for our patients. Our discussions explore the important ways VCA Animal Hospitals proactively supports the future of veterinary medicine through leading the industry in medical excellence and providing hometown care to our communities. On today's episode, I'm happy to welcome Dr. Virginia Frauenthal and Dr. Scott Weese. Dr. Frauenthal is a diplomate of the American College of Veterinary Emergency and Critical Care and is an associate veterinarian at VCA Care's Animal Hospital in Santa Barbara. Dr. Weese is a diplomate of the American College of Veterinary Internal Medicine and a professor at Ontario Veterinary College in Canada. I'm very, very happy to welcome both of you. I know we have some exciting stuff to talk about today.
Thank you. Happy to be here.
Yeah, great. Thanks for having me.
I'm going to jump to the first question and ask both for your brief answer for it. And we'll start with you, Dr. Frauenthal. Tell me a little bit about your journey in veterinary medicine and some of the major events that led to your current position.
Absolutely. I would say that growing up as an only child in Southern California, I definitely was allowed to have any pets that I wanted and considered my dogs and cats my brothers and sisters, and had rabbits and all sorts of different species. So that fostered a love for animals and thinking them as part of the family from a young age. I also excelled in music. Music and science were my things, and got a scholarship to go to UC Davis for vocal performance, but took all of my prerequisites for veterinary school there and did well in those, so got right into veterinary school. Elected to go to Purdue University because they had the smallest class size in the U.S. at that time when I went. That said, there were actually no critical care specialists at Purdue at the time when I was there, so I actually thought that I wanted to go into the field of neurology. Did an internship at the largest private practice, which is called the Veterinary Emergency Clinic and Referral Center in Toronto, Canada, and actually did excel in emergency medicine, like compared to my other intern mates at that time, and then had direct interaction with a couple criticalists there and really fostered a love for emergency and for critical care. And came back, worked emergency for a couple of years. I kind of fell into the residency at the same practice I was at down in Fountain Valley, California, which is now VCA West Coast. And then decided that I wanted to be medical director right out of my residency. So came up here to Santa Barbara and I've been here for 10 years.
Excellent. Dr. Weese, what about your journey in veterinary medicine?
It was a bit of a strange one, I guess. So when I graduated, I went into mixed animal practice, then came back and did a large animal residency, actually. So I'm trained as an equine, predominantly internist. But I was doing research on infectious diseases throughout that. And just basically the way things go, there was a lot of infectious disease, emergence, antibiotic resistance, emerging viral diseases, and a variety of things that I was working on, and largely transitioned to the majority of my work being small animal infectious diseases. But I dabble in other species, do some work with humans, and that crossover, the human-animal interface, really focus on antibiotic resistance, kind of antibiotic use, and anything in the emerging disease world.
While you both have really fascinating careers that we could spend a lot of time talking about, the reason I've asked you both to join us today is to learn more about highly pathogenic avian influenza, which is abbreviated HPAI, that's been traveling through animal species, and the recent occurrence of this illness in pet cats. So let's jump into that. Jenny, this fall in your practice, you saw some pet cats that were eventually diagnosed with HPAI. Can you tell me a little bit about those patients and what kind of signs they were showing?
Yes, that's correct, Marie. I saw 2 patients personally in early December that were eventually diagnosed with that highly pathogenic avian influenza. At that time when they were presenting to my practice, the 2 cats came in probably about a week apart, and they're from completely different families. And they were presenting complaint of decreased appetite or hyporexia, lethargy, just being lethargic and not moving around much, kind of hiding in the closet, things like that. Both patients also had a very high fever. Both were very young cats. I thought because both cats had primary respiratory signs at presentation, that maybe owners would notice that they were coughing. One of the two said that their cat was gagging at home, like a kind of a sound. That said, one was coughing and one was not reported to cough at home.
I know that there can be a number of different causes of respiratory illness in cats. Was it apparent when you first saw them that they had HPAI? Or were you thinking about other diagnoses? And was there anything else in their history that provided some clues to that?
So for the respiratory illness, we definitely heard on auscultation of the chest some abnormal lung sounds, more wheezes than crackles.
Okay.
So that prompted me to get x-rays of the chest right away at presentation. And both of these cats that were involved had like very characteristic pulmonary or lung patterns on x-ray. In my practice, cats don't often get pneumonia. I probably maybe had like 6 cats in my 10 years practicing here that have had pneumonia over the years. So at that time, that did prompt me to get a respiratory PCR polymerase chain reaction on those patients. And that's kind of what ended up with me diagnosing the highly pathogenic avian influenza. So the pneumonia was weird. We were thinking more bacterial, potentially fungal, some sort of viral at that time. And both of these patients were actually in their history receiving a raw food diet, including raw eggs, raw meat, and raw milk. So that had kind of at least increased my index of suspicion for some sort of infectious disease.
Scott, HPAI has been in the news a lot these days. Can you give me an overview of influenzas in general, and what's the evolution of this influenza been?
Yeah, well, there are a lot of terms, and maybe we should kind of talk about that a little bit. So we talk about influenza. Influenza is caused by a virus. There are various types of influenza, and influenza A is the one that we're worried about. That's the one that causes influenza in people. Most of our seasonal flus, it causes influenza in birds and dogs and various other species. There are some other influenzas, but they're not ones that we recognize as a concern moving back and forth, and they're not our pandemic concern strains. So we're talking about influenza A. And within that, there are a lot of strains that we characterize by 2 main components of the virus. They're H and they're N. So H5N1, H3N2. And we also split them in birds into low pathogenicity and highly pathogenic. That's where the HPAI comes from. And that just means what they do in chickens. It really doesn't tell us anything else, doesn't mean anything for mammals, us, dogs, cats. It's what it does in poultry. So we have these influenza viruses that are circulating in nature, largely in waterfowl, especially in Asia, all different combinations of H and N. And there's certain ones that we've been more concerned about. And H5N1 has been one that we've paid particular attention to for the last about 30 years now, I guess, because periodically moves from birds into domestic animals and to people, and historically has had high mortality rates in people, 30 to 50%. That's a little different strain that we're dealing with right now. But that's been our concern. So late 2021, there were multiple emergences that started of H5N1 into birds in other areas in North America. And we're seeing this in various parts of the world. And this has really been a sustained avian pandemic. So it's spreading around birds, really unprecedented in how long it's persisted and how widely it's moved. Usually in North America, you'd see introductions of different influenza strains, and they would typically be eradicated. Now we're just seeing this constant movement of it. It's very common in wildlife. We're seeing spillover into other species because when you get infection in birds, you get exposure of mammals. And that typically is mammals that eat birds. So foxes were one of the species we found, the earliest ones. And any mammal that can have contact with them has some risk of exposure. That includes us, that includes dogs, and obviously cats.
Are dogs and cats more prone to influenza, or is this an unusual situation? And are people at risk from this?
Well, with infectious diseases, we often say, I don't know, because that's where we are with emerging diseases, right? We started out as we see things. So traditionally, dogs have canine influenza. So we have dog flu strains that circulate in dogs. They're adapted to dogs, just like we have our human flus. And those have originated, the current one we have originated in birds, but that circulates in dogs. That's different than we're dealing with right now. Cats don't have their own circulating flu, but we know they're susceptible to flus. They can get flu from catching a bird, and that can include highly pathogenic or the low pathogenicity strains. And they can also get our influenzas, and so can dogs. If you have influenza, you can infect your dog, and usually it's mild disease, transient. It's not going to spread in the dog population. So we've got a few different risks when it comes to dogs and cats. So dogs, we have our circulating strain, which is pretty rare. in North America, the canine flu. We had the potential exposure to human flus, which is always there because flu is circulating in people. And we've got the susceptibility to this H5N1 strain, which seems to be more in cats than dogs. There's, always the question, do we see more cats because cats are more likely to get exposed to birds, or are they actually more susceptible? And it's maybe a little bit of both. But if we look at cats, they have receptors. So a virus has to attach to something on the cell to infect. And cats have pretty good receptors for this virus, and they actually have a lot of it in the brain, which is why we see a neurologic disease in cats.
There's infection in dairy herds as well, and that seems to be part of the raw food connection. So how did we go from birds to dairy cattle?
Well, in the U.S., and this is right now just a U.S. phenomenon, but in the U.S., there was movement of a bird flu strain into cattle. And a strain that just nicely adapted to cattle, especially their udder. And they produce a lot of virus in milk. And that's enabled it to be spread on farms. People handling cattle, transferring things by milk, going cow to cow, and moving cattle between farms. And as you can guess, cats on dairy farms get exposed to milk, spilled milk, leftover milk. And one of the early signs of flu on a dairy farm has been the cats all disappear or they all die because they're very susceptible and they get exposed to a lot. So in the US, this is really widely spread now. It's affecting a really large percentage of dairy herds. And just recently, there have been a couple other emergences of a different strain from birds into cattle. So it started off with, just a random event of a cow getting exposed from a bird with a strain that was able to infect that cow. And now we've seen that a couple times. So this suggests, we've got continued risk of new emergences from birds to cattle. But in the US right now, exposure to dairy cattle and exposure to raw milk because of that is a big concern.
Jenny, with this being such a rapidly changing disease, when did you first learn about cats being diagnosed with highly pathogenic avian influenza?
I first learned about cats being diagnosed with highly pathogenic avian influenza that was linked to raw milk from a dairy farm in Fresno. I think that was in the summer of last year. Mm-hmm. So that was a couple months at least prior to these cats presenting to my hospital. So it was at least on my radar that had been happening somewhere in this region in my state.
And when did you share your suspicion with clients that their cats may be infected?
We shared this suspicion with the clients after we had submitted that respiratory PCR test out to an outside lab. Mm-hmm. And then we received the results back 4 days later for both of the patients. Again, they were about a week apart. Once we got the rapid PCR test back for infectious diseases and they tested positive for influenza A, that's when I knew to be suspicious of that and then contact the public health department as well for their assistance in the case to see if this could be HPAI.
So how did you go from the initial preliminary suspicion to confirming a diagnosis? How does that happen for veterinarians?
For confirming the diagnosis, once we had the influenza A, that's when I contacted the public health department. That's also when I let the client know just that we were suspicious this could be an emerging infectious disease and we need to work closely with the public health department, with the government to be as safe as possible and know exactly what the diagnosis is.
Scott, you've provided guidance on a wide variety of veterinary infectious diseases through your Worms and Germs blog. We'll post a link to your blog in the chat because I find it just really fascinating. It has a tremendous amount of resources, both for pet owners and veterinarians. Tell me a little bit about starting that blog and then how it's evolved.
Well, that started quite a while ago, and actually it was based on some zoonotic disease or public health information we were developing for vets and pet owners and the likes. And we started to put the information together on different diseases and different pets and realized that we have to get them out somewhere. And the era of, printed handouts, they just don't go very far. And there weren't a lot of good ways to get that information out in a sustained manner. It was kind of a fairly new thing at that point. And it's got pretty good uptake. We talk a lot about emerging diseases, which is always popular. I think that gets people's interest. But we do try to provide a lot of guidance. And a lot of the guidance is really making it up as you go, using some basic principles, what we know from other diseases, common sense, and trying to find that balance between protection and proactivity and practicality, right? And I think that's one of the things we get use from that is telling people at the practical level, what are our concerns and what can we do in the clinic? What are things that we really should be worried about and things that maybe we shouldn't be as worried about?
I find myself going to your blog and looking at both the handouts for veterinarians and also for clients. And I love that you have a section of handouts for kids on there as well to help children understand diseases that their pets may be having. And I also love that the information is really practical with what can we do about this and what should we be worried about. On your February 10th post, you really discussed the concerns with this discovery of highly pathogenic avian influenza in dairy herds in Nevada. What was different about that recent discovery?
Well, that's where we started to see another introduction of flu. So I mentioned the first one was there was a strain that came in from birds, spread really widely, and that was a concern, but we kind of had figured out what was going on to a large degree. And we were hoping that if we contain that strain, then maybe we can contain this virus in dairy cattle. But the proviso is, okay, maybe there's always a chance another strain will come into cattle from birds. And that's what happened in Nevada, and that's what happened in Arizona since then. So we've got separate introductions. So one thing that tells us is that just controlling it in one species doesn't do it completely for us, because even if we controlled it in dairy cattle, that current strain, we can get new strains to come in. So that's just a reminder that as long as this circulates in wild birds, we've got lots of different risks and lots of different species. Now, the other concern was this strain that was there. It's a strain of H5N1 that we call D1.1. Mm-hmm. And it's one that's caused some serious disease in people. Like I said, traditionally, H5N1 has killed 30 to 50% of the people it infects in Asia. That's been a different strain. And what we've seen in North America until recently was mild infections, typically in people working with poultry or cattle that were infected, often really mild disease like eye inflammation, pink eye, basically. They get some virus in the eye, they get some inflammation there. And nothing too serious. But there have been a few serious infections recently, and they've been caused by this D1.1 strain. Mm-hmm. And is that because the strain's more virulent, more able to cause severe disease, or is it just luck? We don't really know, but it's concerning now that we've seen a few. There was a person that died in Louisiana from this late last year. There was a teenager in Canada with no underlying health issues that had really, really serious disease and survived, but it was incredibly serious disease. And there's a person in Wyoming right now, I think it's still in hospital with this. And the assumption is, or it's been reported to be this strain. So we're bringing in a couple of different concerns here. It's just more spread into different animals, more movement from birds into our domestic species that could then infect us, and just more spread of this strain that is starting to raise a bit more concern. If it's going to affect people more severely, we got to assume it can affect other domestic animals. And dogs are a bit of a question as well. We're focusing on cats here, but dogs can be affected, and we have seen fatal infections in dogs.
You mentioned earlier that while most influenza viruses kind of run their course and burn out, this one seems to be gaining steam, if anything, and not doing that. Are there any theories as to why this one is different?
It's a good question. We don't really know. Like often when it comes in, you get this rare introduction. So as a bird that migrated or flew off course, came into an area and you infected some local birds or some poultry, and you get on top of that really quickly. With poultry, they usually depopulate it. That's the end of that group. There's not a lot in the wild bird population and it just disappears. Mm-hmm. Why this happens so widely in wild birds, we don't really know. Is it more able to spread in certain bird species? Do they get into the right species, right? It's basically a critical mass issue. It's like people, right? If you have one or two people infected with something, the odds of them meeting someone to infect them and meeting someone to infect them and on you go are lower. The more people you start off with, the greater your chance of getting something that's self-sustaining. And the more transmissible it is, obviously, too. So, and we don't really know both those aspects. So it could just be this strain is really able to infect a wide range of bird species, and they shed it nicely. They're able to transmit it nicely. And for some reason, we've got a good introduction of a reasonable number of them, and that's taken off. And now that it's widespread internationally in lots of different bird species, lots of different countries, and enough numbers there that it can be sustained. That's why we're worried this may be an endemic virus or just a locally resident virus, at least for quite a while. If I can jump back to the animal health side, there's something else we need to think about here is these cats usually die or often die. There have been some survive, but mortality rates are really high.
Okay.
The challenge is we don't really understand the spectrum of disease in cats, right? So do cats usually die? Or do we usually test cats that are dying?
Good point, yeah.
We don't test a lot of cats, right? Cats don't tend to come into clinics very often. Uh-huh. If your cat comes in with normal snotty nose, coughing, sneezing, we don't often test them because most of the time there's not a lot of value. If it's an individual cat, if it's a shelter, if it's a breeder, it's maybe a different situation for the population, but we don't see a lot of cats with milder disease and we don't test a lot of cats with milder disease. So right now we can say cats get severe disease, we can't say they don't get milder disease. And that's a big gap right now. And for us in clinics, it makes it really tough. So do we only flag the cases that have severe respiratory disease, and especially with neurologic disease, or do we need to throw a wider net because we just haven't tested enough cats with mild disease? And that's a challenge. And we don't want people freaking out thinking every snotty-nosed cat might have avian flu, because they're usually going to have our typical cat upper respiratory tract viruses. But we have to realize that we don't have a lot of testing and we don't really understand it. So we have to keep doing a little more work. And this is why we need more surveillance on these milder cases and in areas where you've got cats that are exposed to an animal. So you've got a cat that's had H5N1. What are the other cats around it? Or farm, more surveillance of dairy farm cats. We're trying to do it, but it's actually quite tough to get samples from these more mildly affected cats.
The screening tests that Dr. Frauenthal mentioned that tests in general for influenzas, is that a good way to start with screening?
The labs are a little different what they're doing, and they're kind of evolving what they're doing. And this is a big take home for vets, is understand what your lab does, because not all labs can test for this virus. What's often done, what Ginny mentioned, is what we call a pan-A or a matrix PCR. So that will detect any influenza. Mm-hmm. If it's a cat, it's probably H5N1. If it's a cat that's had raw milk or from a dairy farm, it's H5N1. You can pretty much guarantee it.
Right.
Still, possibly in normal situations, could be some random flu that it got from its owner, or other flus that are in birds right now. So it's not a guarantee. So some labs will do that testing, and then they'll send it off for H5N1 confirmation, which takes a little bit longer. Mm-hmm. Some will do H5N1 testing directly in-house, and that's more common with the university labs and the government labs. They'll go right to that. Sometimes what they'll do is they'll test for that pan-influenza test. And if it's positive, they'll test for the regular suspects, like our normal canine flus and some of the human flus. And if it's negative, they'll say it's untypable, which we assume it's H5N1, or they'll send it off. So it is important to understand what we're testing. But if a lab is using that pan-A, that general flu test, that's a good result, because if it's positive, it means we need to look into it more. If it's negative, hopefully it's really negative, we can move on. So it's a reasonable screening test, but it's really important for us to understand what was done so we can interpret it properly.
And Scott, I think the answer to this is no, but have we had any dogs test positive?
Yep, we've had some dogs that have tested positive. We had one in Ontario a little while ago, and this was a classic situation where the dog was seen to be kind of chewing on a dead goose.
Wow.
And that dead goose was tested and it was positive, and the dog ended up dying. It had really severe, predominantly respiratory disease, but it also had virus in its brain.
Wow.
So similar thing with cats. We don't see it in a lot of dogs, so probably it's much less likely to be a risk for dogs. And the dogs we're really concerned are the dogs that are out with waterfowl, and dogs that might, well, I have a lab, like my dog. If there was a dead goose or a dead duck in there, my dog's likely to at least sniff it, if not try to have a little bit of a snack. So dogs that are exposed to those birds are a concern. Dogs on farms, absolutely as well. And we just don't understand it as much, but dogs are probably lower risk.
Jenny, now that you know about this illness and have diagnosed this in a couple of patients, are you talking to your clients differently? And I know your client population tends to be more emergency critical care, since that's your specialty, but what are you talking to clients about?
Well, I think it's always important to get a very thorough history, making sure you ask those important questions, especially in this situation about the diet, like what they're feeding, what type of food, like where they actually buy their groceries actually came into play in both of these cases as well. And then just being aware that if those animals are on a raw food diet, of course, explaining the risks to the clients if they don't already understand that.
Scott, what would you add to that of pet owners who have concerns about this? I mean, certainly wild bird exposure, but what advice would you give pet owners in trying to prevent illness with this disease?
Well, there are a lot of things we can do to reduce the risk of exposure. So the exposure is going to be from wild birds, infected domestic birds or domestic cattle, dairy cattle in the US, raw milk, raw meat, or the other thing would be people that work with animals that might be infected. And there were a couple reports just recently out of the US where it looked like the virus was tracked home from people that worked on farms, whether that was on their clothes or whether they were actually infected and they infected the cats, which would be a big deal. And we don't really know, but one way or the other, that comes in. So for me, thinking about flu in cases, talking to people, we want to think about the disease and it's that respiratory and neuro combination. And we want to think about the exposure, like we just talked about there. So exposure to animals that might be infected, and exposure to animal products or people that work with them. For your average person that's worried about it, your average indoor cat is going to be exceptionally low risk for being exposed.
Mm-hmm.
And if you don't feed it raw meat or raw milk, it's going to be almost zero risk. And the risk really is, does it have some type of strange exposure through like a window screen with a bird, or does someone track it in the house? So those things are really unlikely. So if we can do some basic things, so avoiding raw meat, especially raw poultry, that's probably the main risk factor. Beef, probably not a big deal. And the little bit of retail beef testing that's been done hasn't found it. So we're really worried about birds. Outdoor reared duck would be kind of the big concern in raw diets, but any poultry I'm worried about. So from the diet side, it's don't feed a raw diet is the easiest way to do it. If someone's really determined to feed a raw diet, feed a high pressure pasteurized diet. And that's a process that uses pressure to try to kill bacteria and viruses. It's risk reduction, not risk elimination. It doesn't prevent it. And there was one case of animals that got infected from a high pressure pasteurized diet. So it's not something that makes it zero risk, but it's going to be better than not. So avoiding raw diets in particular, avoiding raw poultry.
Mm-hmm.
If you're going to feed it, feed a high pressure pasteurized diet. Avoiding raw milk, full stop. There are lots of reasons to avoid raw milk. Flu is just one of them. And the good thing about raw milk and raw meat exposures are we've got alternatives for that. These are easily mitigatable things. For outdoor exposure, if you have indoor cats, the more they can be indoor, the better for lots of reasons. Not every cat can be purely indoor. We realize that. But the more we can keep them inside, basically we want to cut down on unsupervised outdoor time. So dogs, ideally not as much time roaming free, but part of it's understanding the area. So if you're walking in a dog park, the risk is going to be really low.
Mm-hmm.
If you're walking somewhere where there's a pond and there are lots of ducks and geese and lots of duck and geese poop and maybe some dead animals, the risk is coming up. If you see dead birds there or you hear of flu activity in the area, I would not walk there.
Right.
So keeping them under control, avoiding high-risk areas, keeping them away from birds, wild birds is pretty straightforward practices. We can't completely eliminate it, but the odds of exposure for your average household dog or cat that's not going to be fed a high-risk food should be really, really low.
What about vaccination? Because people are vaccinated for seasonal flus every year, and I know we have a canine influenza vaccination. Where are we with vaccination on this?
So for dogs and cats, we don't have any options. For cats, we have no flu vaccines at all. That's the easy one. For dogs, we have canine flu vaccines. That's for H3N2 plus or minus H3N8. And those are different than H5N1. And there's not cross protection there. So we don't have a vaccine.
Okay.
There is a vaccine for birds, and that's been licensed or conditionally licensed in various places. In the US, they just conditionally licensed it. The big barrier to that actually is regulatory and export issues.
Mm-hmm.
This vaccine that does work, whether it works enough to actually have a big impact on a poultry farm, you could debate a little bit. There's the potential vaccines for dogs and cats. Like the platform is there. We know how to vaccinate against influenza. It's just a matter of doing it. And I wouldn't be surprised if companies are exploring H5N1 vaccines for cats in particular on the premise that this might be a sustained issue, but there's nothing that I've heard in the pipeline there. And for people, there is an H5N1 vaccine. Up in Canada here, we just purchased 500,000 doses to have available for emergency preparedness. Not really sure if or when they'll be used, but there are countries that are starting to stockpile the vaccine in case there's a problem. And right now, I guess my kind of line with this virus is we're not really worried about this virus right now. We're worried about what it could become.
Mm-hmm.
Because right now, it doesn't seem like it's very able to infect people.
Right.
And doesn't seem to be able to spread person to person. If you look at its genetics, it's not really programmed to do that. But yet is the disclaimer, because flu viruses like to change. So we're worried about what this virus might become given more time. Every time it infects a mammal, it can change and get more able to infect mammals. And the big one we're worried about is what we call recombination, where you've got a person or an animal that's infected with two flu strains. So if I had H5N1 and I had just regular seasonal flu at the same time, those flu viruses could get together and make a new flu virus that's nicely transmissible like my human flu, but does other things like the avian flu. And that's a potential new pandemic virus. So that's why there are a lot of contingencies in humans. It's for what this virus could become if we keep spreading in an uncontrolled manner like it is.
Scott, tell me a little bit about the concept of One Health, what that means, and how veterinarians are instrumental in healthcare as a whole.
Well, One Health is basically the intersection between human health, animal health, and environmental health. It's something that impacts more than one of those. And for zoonotic diseases that move between people and animals or the other direction, are the main concern. when we talk about One Health in an infectious disease context. And usually we're focusing on things where we get an infection in an animal that can infect a person. That could be regular things like E. coli from hamburger or salmonella. It can involve emerging diseases, SARS-CoV-2 and COVID is a One Health issue. They also go in the other direction, though, because we do see things going from people to animals. So One Health is looking at how these different populations intersect and how we can do things that will improve both of them. So what can we do in animals that would improve animal health, but also improve human health? That's kind of a One Health approach where we're thinking about the broader situation as opposed to, this is a problem, people. I just want to work on people. I don't care what happens in the animals. I'll deal with the animals if we have to, but my focus is purely on the human side. Whereas the One Health, we're trying to figure out how we improve life, welfare, health for both sides of it, or all three if we bring in the environment.
We're nearing the end of our time together. And Jenny, I'm going to start with you. Given that as veterinarians, we see a variety of infectious diseases all the time, how has this experience changed your practice and how you approach the patients that you see, or has it changed your practice?
It definitely has changed my practice. I would say I'm much more familiar with contacting the public health department and working in conjunction with them. But on a day-to-day practice basis, what I've learned is when you have an infectious disease or something that's a potentially infectious disease in your hospital, you're not going to get the diagnosis until days later, until most of the patients are at home. So being as careful as you can while they're in that either incubation period or when they're in that pathogenic period of being able to spread the disease is of utmost importance, especially because a lot of these diseases are things that people could potentially get or that are emerging and can rapidly mutate and change into something that people could get.
Scott, in closing, I'm going to ask you, with a number of infectious diseases, I think people are very fearful. How do we move from being fearful to having respect, but also recognizing the risks and how we can respond to these?
Well, it's tough because it varies with disease, and it really varies with the person. I spend a lot of time trying to get people more aware, and then the other half of the time trying to talk them off the ledge. We want to have more awareness, but we don't want people freaking out every time they see their cat that they might get something. Because the fact is, every animal has something that could be infecting a person, just like every person has something that can be infecting a person. But it rarely happens because of basic things like our immune system and in clinics like our infection control practices. So it's a matter of trying to increase awareness, trying to increase that baseline level of health. Biggest thing we can do for a lot of disease prevention is have healthier animals. And that's better health in our pets, and that's better raising of livestock because they're less susceptible to infections. And it doesn't get us everywhere, but it's one step along the way. And, it always sounds callous, but we usually say never waste a good outbreak because we try to use it to raise the baseline. So raise education a little bit, raise trust a little bit. And trust is the biggest issue that we've had around COVID in particular, but it's going to be an issue with vaccination for anything now. It's not a matter of not knowing the science, it's trusting the science and trusting the people delivering the science. And I think we have to realize that we have to continue to build trust with our clients because there's so many information sources out there. And a lot of them are misleading. And we have to maintain ourselves as this objective, solid, unbiased source of day-to-day information for pet owners and for ourselves as the profession. So I think we need to focus on just increasing that baseline level of health, increasing communication, within vets, within owners, and just getting a little more awareness. Cats, that can be little things that will reduce their risk of other diseases. So keeping them inside as much as we can, keeping them healthy, keeping them vaccinated, avoiding high-risk diets, and getting vet care in general. And also when they're sick, because often cats don't get seen until it's too late or not at all. And also thinking about things like testing. Like I said, we don't necessarily test routinely for mild respiratory tract diseases, but sometimes in emerging diseases, there are benefits for the cat and for the household. Because if this is H5N1 in the household, I want to know for that cat to treat it. And then for other animals that are there for managing them. And public health may want to know for the humans to monitor or to give them prophylactic antivirals. So there are a lot of things where this One Health action actually comes into play if we have more communication and more interaction.
Wonderful. Well, as always, when I speak with you both, I have learned a tremendous amount. I respect you and thank you for your professional contributions and for joining me today, because I know that our listeners have gotten a lot out of this. So thank you both.
Great. Thanks, Mary.
Thank you for having us.
Thank you for listening to today's episode. We hope you enjoyed it and learned a few helpful tips. If you haven't already, I encourage you to subscribe and listen to our previous episodes to hear the many valuable insights and lessons from our past guests. Don't forget to leave a review for today's episode and share with friends. Make sure to follow VCA Animal Hospitals on LinkedIn, Facebook, and Instagram to stay in the loop. For more inspiring stories, visit our website at vcavoice.com.